Loss of vision caused by corneal damages is referred to as corneal blindness. It's the fourth most common cause of blindness, representing more than 5% of the total blind population across the countries. The cornea is a transparent avascular tissue providing an optical interface with a diameter of 12 to 13 mm and a central thickness of 0.5 mm. It consists of three cellular layers: the corneal epithelium, stroma, and endothelium. The cornea's primary functions include protection, transparency, and optical properties. The cornea's epithelium, a highly innervated and regenerative tissue, forms a non-keratinized cell layer approximately 50 micrometer thick, making up to 10% of the cornea's thickness. This layer acts as a barrier against chemicals, water, and microbes. The epithelial cells have a lifespan of 7 to 10 days, undergoing involution, desquamation, and apoptosis. The basement membrane of corneal epithelium, located between the basal epithelial cells and the stroma, is a specialized extracellular matrix crucial for anchoring epithelial cells, facilitating migration, differentiation, and maintaining epithelial phenotype. Persistent corneal epithelial defects can arise due to various causes: chemical or thermal burns, limbal stem cell deficiency, contact lens overuse, mechanical trauma, foreign body intrusion, nerve damage, diabetes mellitus, severe dry eye, infections, autoimmune diseases, rheumatoid arthritis, thyroid eye diseases. These defects can lead to serious complications such as ulceration, neovascularization, conjunctivalization, corneal scarring, and ultimately corneal opacification and visual loss. Various approaches have been developed to regenerate or replace damaged corneas. Traditional treatments include keratoplasty or corneal transplantation and the use of artificial corneas, keratoprostheses, have been effective for many years. However, these methods are limited by shortage of donor corneal tissues and potential side effects associated with keratoprostheses. Traditional treatments are also limited, necessitating more effective strategies for treating corneal surface injuries. Loss, reduction, or dysfunction of limbal stem cells can lead to significant corneal surface changes, resulting in a condition called limbal stem cell deficiency. This deficiency prevents the corneal epithelium from regenerating, causing stromal melting, scarring, conjunctivalization, and neovascularization. Persistent corneal epithelial defects can arise due to various causes. Cell-based therapies are widely used to regenerate corneal epithelium and endothelium. Studies show that it's the most effective method for replacing damaged corneal epithelial cells and regenerating the ocular surfaces. One promising approach is autologous transplantation of adult stem cells, which addresses some limitations of traditional methods. Studies show this is the most effective method for replacing damaged corneal epithelial cells and regenerating the ocular surface. Various corneal and non-corneal stem cells are employed for this purpose. Cell sheet engineering. This technique involves culturing a confluent monolayer of cells in vitro, which can then be applied to damaged tissue. It has been successful in regenerating different tissues by fostering cell-to-cell interactions and ECM development. Scaffold-based tissue engineering. Due to donor shortages, graft rejection, keratoprosthesis drawbacks, and limitations of cell sheet engineering, scaffold-based tissue-engineered corneal equivalents are being developed. Researchers are studying engineered scaffolds, both with and without cells, to support corneal epithelial regeneration. In February 2015, Holoclar became the first stem cell-based medicine authorized for commercial use across the European Union. This therapy addresses eye injuries that destroy limbal stem cells, leading to vision loss, as the cornea is overtaken by conjunctival cells. Holoclar utilizes limbal stem cells from patients' unaffected eye to cultivate a graft outside the body. Transplanting this graft into the injured eye replenishes the limbal stem cell populations, enabling the regeneration of a normal, transparent corneal surface. This advancement marks a significant milestone in regenerative medicine. Many clinical trials across the world have shown the successful data with the various types of the stem cells.